Why the stone is frequent in our society these days, and are there any dietary changes we need to make to prevent this stone? So there are some of the preventive measures which we can prevent stone formation in your kidneys. First is the main cause of kidney stone formation is dehydration. So people have to drink plenty of water to prevent dehydration. Because dehydration causes supersaturation of concentration of the urine, which causes stone crystals in your kidneys, and then they produce stone in the kidneys. So people who drink plenty of water, stone diseases will be less in them. And plenty of water in the sense, patient peeing should be white in color, not like a very high straw colored or dark in color. So that is indicative of one of the reasons why you produce stones. And next is salt intake. People tend to consume a lot of salt, especially this Hyderabad region, who have plenty of pickles, salty foods, junk foods, which needs to be avoided. And per day you should at least consume 4 to 5 grams of salt, not more than that. And avoid salty foods like chips packet, and you should always check high sodium levels in the nutrition chart which they are provided in the fast foods and other packet foods. So try to avoid those things because it has a high sodium, which is prone to cause stones in the kidney. And also animal protein intake, as most of the people here are non-vegetarian, so you should limit your non-veg consumption like red meat and chicken. So it's roughly around 1 gram per kg body weight. Example, if you are 60 kgs, so your safety limit to consume the safety limit to consume protein or meat is around 60 grams. So in that way you can prevent kidney stone diseases. And next is to maintain a healthy diet and include whole grains like oats, barley and other whole grain in your foods. Try to consume normal dietary calcium. And people who doesn't have an indication to take calcium should avoid calcium tablets unnecessary, because that can cause stones. So basically 3 types of commonest stones are formed in the body. One is maximum is 90% of the stones are made up of calcium oxalate, and the second most common are uric acid, and the third are struvite stone, which are also called as infective stone, which are more common in female. So calcium oxalate is the most commonest. These are the dietary habits which if you follow, you can prevent calcium oxalate stones. And also avoid oxalate rich foods like beetroots and spinach. If you take in the raw form, it will cause more stones. In India we tend to boil the spinach, so you can consume a moderate amount of spinach. So you can have that. Unless if you consume in a raw form of spinach and other green leafy vegetables, they tend to cause stone. Otherwise it's safe to consume cooked or boiled greeny leafy vegetables. And in terms of fruits, you should avoid grapefruit, chiku and all other sweetening foods, or apple juices or grape juices. Please avoid that. It has got a high oxalate content. And foodstuffs such as dry fruits, especially if you have enough salted form or a fried form, you please avoid that. And also limit your consumption of tea and coffee and green tea. Green tea is nephrotoxic, so avoid having more amounts of green tea. These are the dietary habits. If you follow, you can further prevent stone in your body. Thank you.